As most Maryland students continue their virtual learning, they may be looking at their computer screens for longer than before. Ophthalmologist Dr. Rudrani Banik is joining us live to discuss potential dangers from digital devices. Doctor, thank you so much for joining us.
Thank you so much for having me.
This has been a topic. Screen time has been a buzzword around parents for a long time with cell phones, games, and then schools slightly going a little bit. Now we are virtual learning for almost everybody out there now, at least in the public school system. What are you seeing, though, in your practice because since this pandemic started, especially related with children?
Yeah, absolutely. I mean, the hours spent on a screen have skyrocketed, and they will continue to skyrocket. The concern is, fortunately, there is no long-term risk of screen time. You know, there's no permanent damage done to the eyes, but there are certainly short-term risks that we have to be aware of. And the main short-term risk is a syndrome called digital eye strain. So that happens to anyone, not just children. It can happen to adults as well. And it includes symptoms such as blurry vision, trouble focusing, dry eyes, light sensitivity, sometimes even headaches and shoulder and neck pain. So it's really important to try to prevent against that. And people are also concerned about the blue light exposure coming from screens. So, you know, these are all valid concerns.
And can you explain a little bit more about the blue light exposure? And then also, does that relate with headaches, or are they separate?
You know, absolutely. So blue light is all around us. It's everywhere. We get natural blue light from the sun that helps to regulate our sleep-wake cycle. But we get blue light from all of our devices, whether it be a phone, a tablet, a computer, even the lights in our homes, such as CFL lights and LED lights emit blue light. And so blue light, you know, it can definitely disrupt sleep, but it's been associated with digital eye strain. And it really is important to try to limit the amount of blue light and protect against blue light. Again, there's no long-term damage, but the short-term side effects are concerning.
So really, when you're starting to talk about this and you see these devices, some of them have where they can take off the blue light on their devices. You also hear about glasses that sell that block blue lights. Are they worth it?
So there is no scientific evidence as of yet that blue blocking glasses actually work. And actually, the American Academy of Ophthalmology does not recommend getting blue blocking glasses. Okay. There are many other ways to protect against blue light. The way that I found that is most effective, that I truly believe is most effective, is our natural blue blocker. So many people don't realize we actually have pigments in the back of our eyes that help absorb blue light. And these pigments are nutrients that we can get from foods or even supplements. And the pigments, they have fancy names. They're called lutein, zeaxanthin, and mesozeaxanthin. We can get them from foods like green leafy vegetables like spinach and collard greens and kale. We can get them from orange peppers, even corn and egg yolk. But unfortunately, we just don't get enough of these pigments. And that's why I do believe that supplementation is important. There are many supplements on the market, but if you look for an ingredient called Lutamax 2020, it has all three of those nutrient pigments in it. So it's a simple fix if you look for Lutamax 2020 on the label of the eye health supplement.
A little bit different than putting down a plate of vegetables when your kids are ready for school there, sitting in front of that computer.
Exactly. It's hard to get kids to eat vegetables as it is. So.
Yeah. All right. Well, those supplements. Yeah. Thank you very much. Yeah. We appreciate Dr. Rudrani Banik. Thank you, ophthalmologist there, teaching us more about blue lights and what we're expecting over the next few months.